Good afternoon, everyone. On behalf of the Clinical Investigation Center and the University Malaya Medical Center, I welcome you to the stage of Dialogue Series, research that touches life, held this afternoon in conjunction to the PPUM DHAT Festival celebration of UMC 57th anniversary. This series is designed to bring our doctors and researchers closer to you. We are delighted to see both members of the public and our colleagues here today. Thank you for being here with us and supporting the spirit of research for healthcare. Today we are honored to have with us Associate Prof. Dr. Rozita Abdul, Consultant Clinical Oncologist at UMC. Associate Prof. Rozita is a clinical oncologist at UMC and was the head of the Department of Clinical Oncology from 2015 to 2019. She graduated from UM in 2000 and obtained a Master in Clinical Oncology in year 2009. She has a strong research portfolio in gynecology, breast and gastrointestinal cancer, as well as sarcomas, and has been actively involved in clinical trials since 2010. She now leads the archery study exploring AI-based radiotherapy, planning to improve cancer care. Prof. Rozita will be sharing about an exciting project called Archery, a 4-year study exploring how artificial intelligence, or we call it AI, can be used to improve radiotherapy treatment planning for cancer patients. In these studies, we focus on 3 very common cancers in Malaysia and worldwide: cervical cancer, head and neck cancer, and prostate cancer. Prof. Rozita, welcome. Thank you for joining us. Can you start by explaining what is radiotherapy and why is it important for treating cancer?
Assalamualaikum and very good afternoon. Thank you for the introduction and also the questions. Right. So, radiotherapy is actually high energy X-ray that is used in the treatment of cancer. So, it actually kills cancer cells by damaging its DNA. The DNA is the molecule that contains the genetic materials in our cells and tissues. Right. So it is important as the cancer can be controlled when the DNA is damaged and the cancer cells dies off.
Your project leading is called Archery. Would you like to explain why is the name Archery and what is the study about?
I will show the screen. So, actually is a prospective observational study of artificial intelligence-based radiotherapy treatment planning for cervical, head and neck, and prostate cancer. So that is how actually gets its name. Okay, so basically, actually study is a study that evaluate the radiotherapy planning assistant, or what we call RPA. It is AI or artificial intelligence driven software in the planning of radiotherapy for certain cancers. So in this study, as mentioned, we included 3 cancers or tumor sites that cervical cancer, head and neck, and also prostate cancer. So this study is actually sponsored by University College of London, and the RPA, or the radiotherapy planning assistant software, was developed by the University of Texas and the Anderson Cancer Center. So this study, if we can go to the next screen, please. Okay, so this study was, the study protocol was published in 2023 when we first started the study. Okay, it was published in BMJ, British Medical Journal. And these are the participating sites for our study. So it actually includes 4 countries and 6 participating sites. Okay, so the 4 countries are India, which has 2 participating sites, the South Africa with 2 participating sites, Jordan, and Malaysia is represented by University Malaya Medical Center.
Thank you, Prof. You mentioned about AI, artificial intelligence. For many of us, AI is something that we associate with robot or apps. How does AI-based radiotherapy help in cancer treatment?
Okay, so if we get back to this study, so the AI was used to develop this software that helps in the radiotherapy planning process. So I think I will just explain a little bit more on this study. If you can look at the screen, the above pathway or the boxes in blue show the manual or the routine pathway that any radiotherapy patients, any patient that will be undergoing radiotherapy, would be going through. And the one below would be the one that is done in this study. So those patients who apply for radiotherapy will be scanned, the area that they want to treat, will be scanned, and these images will be transferred to treatment planning system. And this treatment planning system, is where the clinicians would control or draw the targets, the area that we want to treat, and also the organs at risk, that is the surrounding structures or organs that we want to reduce the dose as much as possible. And after the contouring has been done by the clinician, our medical physicists or dosimetries will work out on the plan. They will put in the beam arrangement, the beam data to optimize the plan and to come up with the intended plan and the doses to the targets. So that is the routine process that will be happening before the patient receives the radiotherapy treatment. So the patient in this study also will be the images that we get from the patient will also be undergoing what we call auto-control by this radiotherapy planning assistant software. And it will also be auto-planned by this software. So we can see that it is all done automatically, and after that, the plan will be reviewed by radiotherapists, and it will be compared to the international standards. So that is the difference that is happening with this radiotherapy planning assistance software.
Thank you, Prof. Rozita, for that explanation. And why do you choose cervical cancer, head and neck cancer, and prostate cancer as the focus of this archery study?
Okay, so if we can see that cervical cancer, prostate cancer, and also head and neck cancer is these are some of the common cancers in Malaysia and also worldwide, and also in those low income, middle income countries. So this is where the problem lies, whereby because of the lack of specialized workforce, sometimes there will be delay in starting radiotherapy treatment. So we are looking at something that could improve the radiotherapy planning process so that patients can get treatment in a timely manner.
How do you think that this AI-based radiotherapy can benefit the community, the patient?
Okay, so if it's proven effective, it would potentially reduce the planning of this radiotherapy treatment so that patients can get the treatment in a timely manner, which, if it's proven effective, then the radiotherapy quality will be improved, and also it will be cost effective because it can be done faster than the usual plan.
So it will be shorter the time from diagnosis until receiving the treatment. So that is in the future that we will see patient will get the treatment plan faster than the manual way admission from the pathway in the first time. And how about, we hear a lot about patient and public involvement in research these days. So how are patients involved in archery studies?
Okay. This study actually includes a component of PPI, or what we call patient public involvement. So in this study, the patients and publics are also our partners. They are involved in the process of this study, and for your information, we have had one session of PPI session with two of our patients, and also include two nurses and study coordinator. So these sessions was done last year, and the patients actually shared their experience and also their challenges in their journey throughout, the radiotherapy treatments for this cancer. So, and they are also important because when we have the results later on, we are going to have them to be engaged and also to have in disseminating the results to the public and also to the other patients as well.
That sounds interesting. What will be the next step for this AI-based radiotherapy research in the future?
We hope to expand to other tumor sites or cancer, okay, apart from the one that we have studied in this study. And we also hope that we could improve the quality of patients' care in the future, especially for those countries or hospitals that have a lack of specialized workforce, and we hope to improve the quality of cancer treatment globally.
Thank you very much, Prof. Rozita, for sharing the important work with us. Ladies and gentlemen, what we hear today shows that how research at UMC does not stay in the lab or in the clinic. It is meant to touch lives, and by making cancer more effective and more affordable and patient-friendly. Now we would love to hear from the audience on the ground. If you have any questions for Prof. Rozita, whether you are a staff member, you are a patient, you are public, please feel free to talk. This is your chance to jump in the conversation. Maybe I'll ask the last question on behalf of. Would you like to share the challenges that you mentioned when you engage patients, and what are the challenges that they are involved in this archery study that is memorable to you?
I think our population is the challenges here is when we want them to be engaged in our research or study, they feel that they are not important. Okay, so these are the challenges where we need to explain to them that actually are very important, because without the patients, this study will not be happening or successful. So in a way, our population is a little bit shy actually to come forward to join us, and we have a session where we discuss about the process, the challenges, and treatments, and so on and so forth. So I think that is the most challenging part when we want to get our patients or public to get involved with this PPI strategy or session.
Okay, once again, we thank Prof. Rozita for the time and sharing and this meaningful and insightful remarks. On behalf of UMC and the Clinical Investigation Center, I would like to present a thank you for your attendance, and for the audience, we have a token of appreciation to Prof. Rozita. To our audience member, thank you for joining us this afternoon. For MC staff, don't forget to register your attendance for the sleeping point. For the members, please do collect your night refreshments. And thank you once again. Hope you can continue to enjoy you and the Happy Festival at our 57th anniversary celebration. Thank you.